Thank you all for joining us. Today we're going to talk a little bit about some of the medical aspects of this virus, which we're learning more about every day here in Colorado, nationally, internationally, especially some of the new impacts that have been found with children with symptoms like Kawasaki's disease, a multi-inflammatory syndrome in children, which is seldom fatal, but in many instances, the doctors worry about long-term heart damage for those who are affected. But I think the biggest takeaway is really how little we know about this very strange virus, this novel coronavirus, which has manifested so many different kinds of seemingly mutually exclusive and different symptoms across the world. They might not all be borne out clinically as resulting from this virus, but we've seen everything from circulatory and clotting issues to organ inflammation and failure to, of course, the lung issues that are the hallmark and often the fatal aspect of this disease, to circulatory issues in the toes and extremities, to multi-inflammatory syndrome in children. And of course, one of the most unusual, and I'll put sort of the positive and negative spin on it, but one of the most unusual aspects of the virus is the high percentage of people that are asymptomatic that spread it, right? We all know the legend of, Typhoid Mary, right? Somebody who didn't have any typhoid symptoms, but was contagious and had hundreds of cases that were traced to a somewhat fictionalized version of her, but probably several people that were asymptomatic that spread typhoid. That is not abnormal for this disease. There are many Typhoid Marys among us, unknowingly, people who are contagious and have no symptoms and wouldn't even know it. Might be contagious for a week, might be contagious for 3 weeks. That's why there's no substitute for our efforts, your efforts, on staying 6 feet away from others where you can and wearing masks. When you go to the store, we hope that any worker there, if they're sick, they're staying home. There's been a number of outbreaks at different stores, but there is the real danger of somebody not even knowing that they're infected because they have no symptoms, and yet they pass it to somebody else, and that person could be hospitalized 7-8 days later. So another area of inquiry for scientists, not the one of the topic of the presentation today, but they're trying to determine whether there's genetic markers or other markers to see who has such an adverse manifestation of this disease and who seems to have no symptoms. They don't yet know what leads to that. There's correlations, hypertension, obesity, with poor clinical outcomes, but there are people in all those categories, people with obesity, with hypertension, who are still asymptomatic and spread it. So they're not determinative, they're correlated. So it's a lot of mysteries. We're learning more every day. In the early days of COVID-19 and through today, thankfully, I would add, we are seeing a much lower fatality and hospitalization rate in children. But the flip side of that is people of all ages have succumbed to COVID-19, and that while children have milder presentations of symptoms, and in fact some that later present with multi-inflammatory symptoms didn't even know they had COVID because they test positive when they're admitted, and that's what seems to have caused their multi-inflammatory syndrome, but they did not have any fever or symptoms in that earlier stage. We don't have the conclusive statistics, but whereas for the general population it's estimated that around half of people who contract COVID-19 are asymptomatic, I think we could say it's likely even higher. For children. We don't know that for sure, but it's likely even higher. But certainly at least half of children are not showing the fever, the cough, any of those symptoms. But some of those after that, a week or two later, are showing a very odd set of symptoms, including several here in Colorado. Now, it happens that Children's Hospital is one of the leading research institutions in multi-inflammatory syndrome in the country. And of course, Colorado parents, like others across the country and world, have been alarmed by reports of the COVID-19 linked symptoms of children in Italy, in the UK, in New Jersey, in New York, in Massachusetts, and Virginia. And it has a correlation with those who just got over COVID-19, have antibodies in the system. And while the syndrome is, again, seldom fatal, It often requires clinical intervention, and it can cause lasting heart damage as well. We have two of the top medical experts here, our state epidemiologist, as well as Dr. Dominguez from Children's, who has both an MD and a PhD, which you must really love school, because that's always so impressive. I had friends that when they went to get their, MD, I finished with my undergrad, and they're finally getting out to be able to practice 7-8 years later, after all that. And then, my goodness, going in for a PhD, I don't know if it was before or after, but another 4 or 5 years. It's amazing. So thank you for all of that. The good news is, as far as we know, multi-inflammatory syndrome is rare. Children typically recover after the acute crisis phase. They do often need clinical treatment to maximize their chances. I want the people of Colorado to know that we are taking, just as any new risk that we find about this virus, we're taking this very seriously. We're working hard to educate community doctors out there about what to look for, what to see. And we're very thankful that doctors at Children's Hospital has the expertise to quickly diagnose and treat children with the disease to help inform others. I'm grateful to be joined by Dr. Dominguez. He's the medical director of the microbiology lab at Children's Colorado. And Dr. Dominguez is also a leading pediatric expert on COVID with a lot of groundbreaking observations. We're also joined by Dr. Rachel Herlihy, our state's epidemiologist, who's doing an amazing job helping to guide, provide the best science to me to make the policy decisions that need to be made. Who will talk a little bit about this new challenge. Please join me first in welcoming Dr. Herlihy.
Thank you, Governor, for the opportunity to talk about our younger Coloradans and how COVID-19 might affect them. We are truly fortunate to have Children's Hospital Colorado as a good friend to public health and an excellent partner in identifying and treating diseases and conditions that affect children. Multi-system inflammatory syndrome in children, abbreviated MIS-C, appears to be related to COVID-19, sometimes appearing weeks after a young person was infected with the virus. We have seen it in individuals up to age 20, and it often affects teenagers. The State Health Department, along with local public health and healthcare partners, have been watching how this syndrome has unfolded in other states and countries. We alerted the healthcare system here in Colorado through a Health Alert Network, or HAN, message last week, and discussed it on many of our calls and webinars with healthcare providers in the last 2 weeks. We're working to ensure providers know what to look for and how to report suspect cases to public health. We are casting a broad net to look for this inflammatory syndrome here in Colorado, and as the governor mentioned, we have found 3 potential cases, which we have reported to CDC for further review. In the next few days, those cases will be reviewed in detail, and a determination will be made if the cases are confirmed or not. One of those cases was identified through review of previous cases in the state, and 2 other cases were identified more recently. To protect patient privacy, no other details about these cases will be available. Additionally, we and our partners at Children's Hospital Colorado are working to determine whether any previously identified cases of COVID-19 that we continue to identify as we look back in our records could potentially meet CDC's case definition for this syndrome. We know parents and guardians are worried about this condition in our young people, especially since COVID-19 itself is normally very mild in children. By definition, young people who develop this syndrome are sick enough to require hospitalization, but most recover well. Parents should call their child's doctor for advice when their child has concerning symptoms. We can't predict how many kids in Colorado might wind up with this syndrome. We do know that it appears to be rare, and our partners at Children's Hospital Colorado are in a great position to be able to identify and treat the illness. Thank you again, Governor Polis, for this opportunity to devote some time to talking about how COVID-19 might affect younger people. I'll now turn it over to Dr. Sam Dominguez from Children's Hospital, who will talk more about MIS-C and what parents should look for.
Hello, thank you, Governor Polis and Dr. Herlihy, for inviting me to speak today. And yes, I do like school. It's a big joke in my family, actually. To talk today about this newly described and emerging syndrome, MIS-C, or multi-system inflammatory syndrome in children. First of all, I want to reiterate that overall, children who are infected with the SARS coronavirus 2 virus do very well. We are fortunate that COVID-19 has not impacted kids as severely as adults. The majority of infections in children are either asymptomatic or mild and do not require hospitalization. In regard to this new syndrome, MIS-C, I want to first emphasize that this syndrome is quite rare. The first cases of MIS-C were reported in countries throughout Western Europe only a few weeks ago, and were initially given the name Pediatric Multi-System Inflammatory Syndrome, temporally associated with COVID-19, or PIMS. Quite a mouthful, but I just wanted to make sure that we understand that that syndrome is the same syndrome we're talking about that the CDC has named MIS-C. In the past week or two, there have been just over 100 total cases reported in multiple states throughout the U.S., with the most cases being reported in New York. We have been involved with the care of 3 children with suspected MIS-C at Children's Hospital Colorado, but due to patient privacy concerns, I can't go to any specific details regarding these patients. Because this is a new and emerging syndrome, there is still a lot that we do not know about MIS-C. What we do know is that it has a strong association, both temporally and geographically, with the SARS-CoV-2 virus. This suggests that with most cases presenting about 4 weeks after exposure to the virus. This suggests that what we are seeing in these children is likely a post-infectious or inflammatory response to the virus, as opposed to direct ongoing damage from the virus itself. From a clinical standpoint, we know these children are presenting with very high fevers, usually for multiple days, with evidence of a high degree of inflammation in their bodies and involvement in multiple body systems. In particular, most of these patients have presented with gastrointestinal complaints consisting of severe abdominal pain, vomiting, and sometimes diarrhea. These patients also present with low blood pressures and inflammation of the heart muscle. Of note, the majority of these patients do not present with respiratory symptoms. Finally, a subset of these children have presented with symptoms similar to Kawasaki disease, in particular rash, red eyes, and red lips, or a red strawberry-like tongue. I mentioned Kawasaki disease because there's been a lot of discussion about how MIS-C is similar and different from Kawasaki disease. Kawasaki disease is a febrile inflammatory illness of children that primarily affects toddlers, with 80% of the cases occurring in children less than 5 years of age. Kawasaki disease is known to be a systemic vasculitis, meaning it's an inflammation of the blood vessels that primarily affects the medium-sized arteries, and in particular can cause inflammation and potentially damage of the arteries that supply the heart, the coronary arteries. Unfortunately, we don't have a specific diagnostic test for Kawasaki disease, so diagnosis is made based upon clinical criteria, including fever for multiple days, evidence of systemic inflammation, and multiple clinical symptoms including rash, red eyes, red lips or tongue, enlarged lymph nodes in the neck, and swelling or redness of the hands and feet, similar to some of the findings that have been seen in this new syndrome, MIS-C. At Children's Hospital, we are very aggressive in diagnosing and treating children with Kawasaki disease because about 20 to 25% of children who are untreated can go on and have inflammation and damage of the coronary arteries that can result in these arteries getting bigger and the most severe form causing outpouching of the vessel walls or aneurysms. Interestingly, several of the patients who have had MIS-C have also been reported to have complications of the coronary arteries, similar to what is seen in patients with Kawasaki disease. I think it's also important to point out some key differences between this new syndrome and Kawasaki disease. First of all, while Kawasaki disease primarily happens in the toddler age group, most cases of MIS-C have occurred in older children, in ages 5 to 15 years old. Kids with this new syndrome also are much more likely to have severe abdominal complaints, have heart problems, and blood pressure problems compared to children with Kawasaki disease. It is important for parents and providers to be on the lookout for kids with potential MIS-C and Kawasaki disease, as both likely benefit from earlier recognition and treatment. In particular, parents should call their primary care providers if their children have several days of high persistent fevers, are having severe abdominal pain, or have a combination of any of the symptoms that can be seen in MIS-C or Kawasaki disease that we discussed, such as the rash, red eyes, red lips, the lymph nodes in the neck, or hand and feet involvement. I want to highlight that our team at Children's Hospital Colorado is well prepared to recognize and treat patients with MIS-C. We have a long history of recognizing and treating new and rare syndromes. Of particular note, toxic shock syndrome was discovered at Children's Hospital by my colleague and mentor, Dr. Jim Todd. My colleague, Dr. Mimi Godet, pioneered the use of intravenous immunoglobulin for the treatment of Kawasaki disease, and we have a nationally recognized Kawasaki disease clinical and research team. Furthermore, we are part of an international working group of pediatric experts who are caring for these patients. Children's Hospital has formed a multidisciplinary team consisting of our infectious disease experts, rheumatologists, cardiologists, hospitalists, and intensive care and emergency care providers, and have jointly drafted guidelines to assist in recognizing and treating patients with MIS-C. I want to end by saying that I know that there are a lot of parents who are afraid and anxious when it comes to thinking about this new SARS coronavirus and about going to their provider or bringing their child to the hospital. This is a normal feeling and expected whenever we are faced with uncertainty and something new. But I want to reassure everyone that it is very safe to bring your child to the hospital for care. We at Children's Hospital Colorado have taken all the necessary precautions to ensure that our children are safe and provide the care they need. Additionally, primary care offices around the state have worked very hard to keep their clinics safe, and they are prepared to see your children. It is critical that children continue to receive their needed checkups and vaccinations during this time. Thank you very much, Governor Polis.
Thank you. You know, and I'm sure you'll have a lot of medical questions here, but I think the biggest thing to reflect on is however much we think we know about this virus, there's even more that we don't know. It's similar to, people might recall the early days of another virus that took far too many from us, the HIV virus and AIDS. In the early days, it manifested with people going in with sarcoma of unknown causes, these rare diseases, and sometimes dying from them in San Francisco and New York. And it took many months and years to figure out what was happening. First, the isolation of the virus itself, the detection of HIV that caused AIDS, and then learning about all the different clinical manifestations of that. This one, too, I think that scientists across the world have made great progress in a short period of time, but there's still more that we don't know than what we know about this virus. It is a zoologic virus, just as HIV/AIDS was from primates. This was from bats, likely through or perhaps through an intermediary species like the pangolin, which also should cause us as humanity, as a country, as a state, to reflect on our practices around animals. One of the bills that I used to sponsor in Congress and I would call upon Congress to pass is one that could prevent a future pandemic of antibiotic-resistant bacteria. There is no good reason for prophylactic use of antibiotics in non-sick farmed animals. Very dangerous. We are asking for it. We already have antibiotic-resistant bacteria. It's extremely dangerous, extremely deadly. It's not a matter of if it's a matter of when. I hope that Congress and the world act to, of course, allow sick animals to be medicated with antibiotics, but we don't dose healthy humans with antibiotics, or we would cause greater incidence of antibiotic-resistant bacteria. And we're doing that on even we're doing it on even greater scale to the detriment of human health in big ag. And so I hope that in addition to closing wet markets, obviously not legal in our country, we should crack down on any that are, but I'm grateful that China has banned them. That needs to be enforced across the world. We should also look at our sustainable practices to make sure that we are not creating the very next pandemic like this one from a zoologic cause, just as HIV/AIDS was, just as coronavirus is, just as the flu was, the 1918 flu, avian-derived flu from birds. So really important in terms of husbandry practices, as well as limiting the wildlife or bushmeat trade to make sure that we can contain the next pandemic before it starts, because we've all found out it's not very fun to try to contain it after it starts. So let's do better with the next one. I have a few updates before we get to the questions. I first want to give my praise and thanks to The brave women of the Colorado National Guard, men and women, who put their lives on hold to help us respond to this crisis. Just so everybody knows, the Colorado National Guard is the branch of the U.S. military that serves as the first line of defense for the United States. It's summoned to active duty by governors in both the 50 states and 3 territories. They respond to domestic emergencies, our flood of 2013, fires in other areas, hurricanes. Thankfully, we don't have hurricanes here. Earthquakes, and in this case, a pandemic. This is the largest domestic deployment of the National Guard since Hurricane Katrina 15 years ago. State of emergency in all 50 states. And they are helping in so many ways, conducting testing sites across the country, here in Colorado, helping protect our senior care facilities, working to save lives. They are helping us be able to return to more normal economic and social activity through their work. And in this, we should recognize that the men and women of our Colorado National Guard are patriots who continue to go above and beyond the call of duty. When our state, when our country needs them, they leave their jobs, they leave their families, and they serve. They rise to the occasion. They mobilize without hesitation. They tackle the mission at hand. Many of them are on leaves of absence from their regularly paid jobs. Earlier this year, I was proud to sign a bill that raises the pay for many of our Colorado National Guard members, but we know that they deserve even more. They are our friends, our neighbors, and they are our heroes. The National Guard deployment was set to end May 31st, and while I was pleased that the White House extended that 24 days to June 24th, we need the National Guard longer through the end of the year, and they need us, because here's the rub. For the Guard members themselves who are putting themselves at risk, many have actually contracted the virus. Ending the deployment on June 24th, right in the middle of the week, means that thousands of them find themselves with 89 days of duty credit, 1 day short of eligibility for retirement and education benefits under the post-9/11 GI Bill. So this is an issue not only where we need our National Guard in Colorado and across the country, but this is wrong to deprive them of 1 day of duty and thereby deny them the benefits that they have earned by putting themselves at risk. If this decision stands not to renew our National Guard past June 24th, it not only hurts our emergency response, but it does a huge disservice to our heroes. It would be a cruel insult to our brave Guardsmen and women whose families have sacrificed so much to put themselves at risk, many of whom have even contracted the virus, serving on the front lines of the worst public health disaster in a century, the worst pandemic since 1918. And I'm proud that on April 29th, every single member of Colorado's congressional delegation, Democrats and Republicans, sent a letter to the White House imploring the president to continue the Colorado National Guard service through the end of the year, and to do right by us and to do right by service members. And I hope that that decision is made for our benefit and for theirs. I also want to thank everybody who's given to the COVID-19 Relief Fund, helpcoloradonow.org. That fund, our fund for Colorado to help those most at need who are suffering the most, has raised over $18 million so far. And you can contribute at helpcoloradonow.org. They've approved their third round of funding. None of the money that you donate will gather dust. 134 grants just went out, and it's helped people in every county in the state, which we are so proud of, because nobody has been untouched by this virus from a health or economic, psychological, or social perspective. They're currently making decisions on the fourth round of funding, and we're proud to say the fifth round of funding is now open for applications about impact and recovery. And if you're an organization seeking funding, the deadline to apply is Saturday, May 30th at 7 p.m. And for today's special shout out, I want to highlight another opportunity for organizations to secure funding. The Rose Community Foundation is accepting funding requests to support organizations that are working to mitigate or alleviate the impacts of COVID-19 for mental health, behavioral health, job loss, food insecurity, really all of those key areas. You can visit the Rose Community Foundation website to find out how to apply. Thank you, Dr. Herlihy. Thank you, Dr. Dominguez, for everything that you're doing to advance scientific knowledge so that we can learn more about the clinical implications and the public health implications of this strange and deadly virus. The information we shared with you today is just another example of how novel and unknown this virus is. And that's why we are all working day and night to help stop the spread, while you have been so successful staying at home where you can, limiting interactions, wearing masks when you're in stores or in public. It's showing up in the numbers. Your success is having a profound impact in helping us open everything sooner, get back to work, and get back to normalcy. And you're grateful for it, and I'm grateful for it, because I want to be governor of a successful, open state, just as you want to live in a successful, open state. I've said this many times, and I want to say this again, especially with Memorial Day weekend ahead. This is not a vacation. This is a global pandemic that we need to treat it as such. And there are always going to be, there's always Coloradans who are ignorant and selfish, but thankfully, the vast majority of Coloradans are smart people who take precautions when we need to. Most Coloradans, I think I read the other day somebody was caught going 130 miles an hour on one of our highways, and I think the state troopers thankfully apprehended them. You know what? Most Coloradans don't go 130 miles on our highways, even if you thought you could get away with it. Because you know that the life you're putting at risk is first and foremost your own. And so too, I'm so proud that the vast majority of Coloradans are reducing their social contacts, staying home more, wearing masks in public, and being smart. And just because we're all tired of living in a heightened threat out there, we all know that that has not made the threat go away. And you're sick of it. I'm sick of it. We're all sick of it. Not literally, thankfully. I tested negative. I'm not sick of it yet, thankfully, knock on wood. But the fact that we are sick of where we are is not an excuse to behave in risky or ignorant behavior that makes it worse for yourself and others and puts your loved ones at the most risk, and of course society at a greater risk. If we want, which we do, restaurants to open, if we want kids to be able to return to school, if we want to be able to ski next season or even this season, and if we want to save the lives of our loved ones or even ourselves, we need to do our part, stay home where we can, remain 6 feet from others where we can, and wear masks when we're in public. And it's especially important with the holiday weekend coming up. This isn't exactly a normal Memorial Day weekend. It's a Memorial Day weekend in the middle of a worldwide pandemic, the worst pandemic that we hope that we ever face in our lifetimes, and the worst global pandemic since 1918. It's not the time for big family reunions and massive cookouts and celebrations. We should honor this Memorial Day by doing what Memorial Day is all about, and that's solemnly honoring the fallen, taking a quiet time out to remember why we have this holiday, to honor those who died in our nation's service. We don't want to cause more deaths and desecrate their memories by celebrating a holiday that is designed to memorialize those who made the ultimate sacrifice for our country. Might mean a quiet trip to Fort Logan or a cemetery to visit a grandparent who served with distinction or lost their life in the line of service. It might mean reflecting for a moment at home about how proud we are of the men and women who defend our freedom, and how grateful we are for the sacrifice of those who have paid the ultimate price. Before I take questions, I want to let you know that because Monday is Memorial Day, we'll do our next public availability tomorrow with Mayor Hancock, and then our next question and answer press conference on Tuesday. And I'm happy to take some questions now. Thank you. Yes.
Governor, thank you. You guys mentioned that there was at least one child and possibly two others. Questions are going to be asked by parents a lot now after they hear this information today. Is there any statistical data to show how many more children in Colorado may already have this MIS-C or perhaps have?
Yeah, if Dr. Dominguez can sort of give some advice to parents, what should you look for? When do you have to worry? When should you call your doctor? And I think that a lot of parents, like I have an 8-year-old and a 5-year-old, I'm listening, and I know that many parents are listening.
Yeah, I think what I would tell parents, particularly things to look for, are if you have multiple days of high fevers, that would be a concern to call your primary care provider. The other things that are presenting most commonly with this syndrome is actually pretty severe abdominal pain, and so it'd be another concerning sign that you should talk to your primary care provider about. And again, the things that look like Kawasaki disease, so red eyes, red lips, rash, any constellation of those symptoms together would be a reason to call your primary care provider as well, so they can talk to them about this and whether or not you need to be getting further tested or to be referred to for more specialty care.
Thank you. Telephone?
Yes, your executive order seems to give public colleges latitude in how they use the CARES Federal Act money as COGS and workforce development. Is how the state using that money permissible for higher education, especially in light of large cuts made yesterday? And if so, how does your administration come to that conclusion?
There have been costs borne across all segments of society in this crisis, and certainly our community colleges, our schools, our county health departments, our cities, our counties, all of them are in different ways on the front lines. For community colleges, immediately canceling in-person classes, shifting to online, in many cases helping students who didn't have access or computer equipment with the equipment. So all of the entities that the money has been pushed out to from CARES Act are eligible entities under the CARES Act. They're cornerstone parts of our society and our success. Workforce, skills, making sure that parents are able to go to work by having reliable schools that are doing a good job educating the next generation. Cities and counties, most of which didn't get money directly under the CARES Act, only the largest ones do, which is why it had to be sent out to the smaller ones. So those on the front line in our communities are doing everything they can to tackle the health, economic, and psychological challenges faced by the COVID-19 pandemic. Yes?
Governor, can you address, you mentioned numbers a little bit, and I'd like, if you wouldn't mind, Dr. Hurley weighing in as well. We have heard from a lot of people that seem frustrated with the numbers that have been kind of changing. The CDPHE website yesterday even had a different look under COVID-19 data. Do you acknowledge that there's a difference between dying with COVID-19 and dying from COVID-19? And what do you say to people that are frustrated at the numbers right now?
Well, I was very frustrated, and and Rachel knows that. I was frustrated because when I found out that, people that tested positive but died of something else for which COVID-19 may or may not have been a contributing factor were mandated to be reported to CDC. I said, fine, report to them what they want, but we also need to let the people of Colorado know how many people have died from COVID-19 according to their attending physician, coroner, or death certificate. So all of those numbers are now reported. We want to err on the side of providing more information. So if you see differing information out there, it's because they're all valid. I mean, it's interesting to know how many people died with COVID. That's a fascinating thing to know. It's also interesting to know how many people died of COVID. The actual number is very likely in between, and keep in mind there are also people that likely died with COVID and of COVID that have not been discovered or found or reported. It's unquestionable there are some, how many we don't know. We also don't yet know how many of those who died with COVID that might have been, for some of them, a contributing factor. But what is most paramount here, and what most Coloradans think about how many people died of COVID, is being reported out regularly by the terrific professionals at CDPHE. It required a change because that was not required by CDC, and we asked them to take on, and they successfully have, this additional information so the people of Colorado can have full, entire confidence in the number of fatalities that are being reported. Dr. Hurley?
The trust issue right now, do you think?
I think the more information that we can provide, the greater the public trust. And we always want to err on the side of providing more information to the public in all ways. And that's why the website is far more thorough than it was. People said it didn't have racial data. We added that. It didn't have enough geographic data. We added that. Go to covid19.colorado.gov. I think there's 10 times as much data as there was a month ago on there. I mean, there's an enormous amount of data, and we want people to be able to parse that every way they can. That means, armchair scientists, and consumers. Dr. Hurley?
Yeah, absolutely. I mean, we want all of the possible data that we can produce to be available on our website so that individuals can consume that data and really understand the situation with this virus here in Colorado as best as possible. And that really requires looking at death data specifically in two different ways. There's reasons to collect data in different ways. One system's faster, simpler for us. It gave us numbers earlier on, but obviously there's an important reason to be tracking numbers of COVID cases that resulted in death, where we know that COVID-19 was the cause of death. And so certainly support having as much data as possible on our website and allowing people to make decisions themselves with the data that's on our website and think through it themselves.
Telephone?
Governor Polis, good afternoon. It's David Clue at Denver 7. Thank you again for this opportunity. Will the new threat of this inflammation virus impact what will be the state's guidance for daycares and the return to school this fall?
This is more a heads up for parents to know what to look for. I don't think we know enough to know whether this would have any impact on that. It is still the scientific consensus and our belief that the risk is greater for those over 65 and the risk is less for children. It doesn't mean that there's no risk for children. But as we think about a safer school environment, as we think about safer summer camps, of course, yes, we're worried about the kids, but there's even bigger concerns about the health of the adults, and particularly the older adults that interact with those children as teachers, as counselors, and as supervisors.
We're about 3 weeks now into the safer at home period. I'm wondering if you're happy or pleased with the results that have come out, or if there's any warning signs. Dr. Hurley, I wonder if there's things, if you guys think this has gone well, and what maybe needs to be tweaked.
So far, so good. And we had to build in a timeline longer than I would have liked to make sure that I have a degree of certainty that we can move forward, and that's why we identified Monday as the day that we'll be making some of those determinations, and then June 1st, for the rest of June, but at least restaurants on Monday, ski restaurants, summer camps Monday, and then other things later before June 1st. So far, so good, but we always are wary and worry if there's, a spike in the next few days. We need to know that. And so far there hasn't been a spike. There's been regional outbreaks. There's been other areas that have had decreased incidence regionally, but statewide, Coloradans have done a very impressive job. You really have, staying home when you can, wearing masks when you're in public. And I understand that, you and the media and viewers as well, they like to do the man bites dog, right? You like to say, here's a bunch of people partying at Boulder Creek or at Chatfield Reservoir. And the untold story is that the vast majority of Coloradans are staying safer at home, going out when they need to, wearing masks in public. And this is a numbers game. It's a numbers factor. Nobody ever expected that 100% of Coloradans would do what they're supposed to be doing 100% of the time. The goal in this is, on average, to be around 60% social distancing. And that means that on average, if for Coloradans who interacted with 20 people a day, last January, that number should now be around 8 to 10 people, eight people or so. So on average, we're hitting that. And that means that, there's somebody, my parents among them, 76, they have limited their social interactions to essentially zero, which is great, 100% reduction. And there are Coloradans that are falling short of the benchmark of 60% social distancing. But from the public health and epidemiological perspective, it's important that we achieve that as a society, as an average. And so far the indications are that we are. Telephone?
Good afternoon. Live in Colorado politics. Joint Budget Committee, after we cutting still $1 billion short of balanced budget. Your budget office has lots and lots of. What else does that?
So I was not following the Joint Budget Committee this morning. I was getting ready on the health stuff and on a number of phone calls. So I can't comment on that. If there's a particular action they've taken, you can ask my office, and I'm happy to react. But yes, we have, through the great work of Lauren Larson, OSPB, offered up a number of different ideas for how we can bridge that gap. Look, the people of Colorado know that there's belt tightening across the entire economy, across every sector. I mean, some families have gone from 2 income to 1 income. Some families are making a little less because they're on unemployment. Some families are out of work. So, of course, just as families are tightening their belts, governments are tightening their belts, school districts are tightening their belts. That's what we all do in tough times to get through. And I'm confident that the state of Colorado will emerge out the other end healthier and stronger than ever before.
Governor, you mentioned this briefly, but how concerned are you about the increased number of cases in the metro area and El Paso County, and how is that related to more increased testing?
We were very proud to announce that anybody who's symptomatic should get tested, and we have over 34 free community testing sites, covid19.colorado.gov. Yes, it's expected that as we test more, we will be picking up more of the people that have COVID-19 and having them included in the official report. That alone doesn't mean that the incidence rate has gone up. It means that we've caught more of them. I think in the early days, this is not even the early days. Everything is a blur the last 2 months. This was a few weeks ago, Dr. Hurley. I think we thought we were catching maybe a quarter to a third of the cases. As we have a lot more testing, we're probably getting closer to half the cases, maybe even more as we go forward, that we are positively identifying of the symptomatic cases, I should add. We are only picking up a small fraction of the asymptomatic cases because we obviously don't have the ability to test everybody. We are really focusing those on testing people that work around those who are at high risk. People who work in senior facilities, and they're also available if you're asymptomatic for those frontline workers, nurses, first responders. If you work in a grocery store and exposed to hundreds of people a day and have been working through this crisis, yes, you can get tested as well, even if you're asymptomatic. So, but they're very targeted. So yes, the number we expect we're catching more of the cases. That is factored into our modeling, meaning that doesn't automatically mean there are more cases. We are taking into account the increased testing and the understanding that now we are picking up a higher percentage of the cases. Telephone?
Hello, Governor. This is Vinny Del Giudice at Bloomberg News in Denver. Another question about healthcare modeling. How many COVID-19 deaths in Colorado are projected over the next 30 to 60 days and through the end of the year? Thank you.
Well, look, the number of active infections and deaths will directly flow out of the behavior of Coloradans and how well we socially distance. If what happened at Boulder Creek and Chatfield Reservoir was the norm, and that was most of us, we would have thousands or tens of thousands of deaths in the next few months. The fact is that's not most of us. The story is largely untold because it's not as exciting of so many Coloradans who are staying at home when they can, wearing masks when they go out, being prudent, avoiding large public gatherings of more than 10. And statistically, certainly the wide body of evidence shows that that's what Coloradans are doing. And I'm confident that that's what Coloradans are doing. So the future trajectory of the virus in Colorado is in your hands, not mine. It depends on smart actions, responsible actions that keep you and your loved ones safe. In the room? See? And we'll do one more in English. Yes.
¿Qué opciones pueden tener los restaurantes que no tienen un lugar afuera para poner mesas?
Sí. Un gran cosa aquí en Colorado es nosotros tenemos bien temperaturas en el verano para comer afuera. Es mucho más seguro afuera porque podemos tener más distancia entre mesas, por ejemplo, en un restaurante. So, sí, algunos van a abrir también en el restaurante, en el cuarto, pero también estamos trabajando con las ciudades para abrir calles y lugares de parking, de carros, para poner más mesas y tener más decencia porque es más seguro para los clientes y también para los trabajadores en los restaurantes. We'll do one more in telephone, and then one more, and I'll go to Stefan. So phone.
Hi, Governor. This is Kara Mason from the Sentinel in Aurora. You've set aside $157 million of CARES Act funds for local health departments in their response to COVID-19 for the upcoming year. But is there any clear picture yet on how much contact tracing will cost in Colorado? I know that Tri-County has already told me that they would probably need to hire at least 80 more people to successfully do that work.
Yeah, we're really excited about the testing and contact tracing work. I'm going to have Dr. Herlihy address briefly some of the exciting developments in contact tracing as well, state and local.
So our strategy here in Colorado is to build infrastructure for contact tracing both at the state level and at the local level that really works with the existing structure we have for public health here in Colorado. And so our goal is to both increase the number of staff at our state health department that are doing this work and doing this work together with our local public health partners and really serving in a surge capacity for our local public health partners that need some assistance in doing this work. At the same time, we want to make sure that our local public health agencies are sufficiently resourced to be able to do contact tracing in their own agencies. And contact tracing is really one piece of a larger containment strategy. So while we're building contact tracing capacity, we are also building case investigation capacity, outbreak investigation capacity, and also ensuring that there are sufficient resources in our local communities to serve individuals who are in isolation and quarantine and make sure that their isolation and quarantine experience can be successful and that they can continue to stay home and protect their community. So making sure they have the prescriptions they need, the groceries they might need while they're in that period of quarantine or isolation. So really it's part of a much larger strategy for overall containment here in the state.
And this is important expectations. None of us liked that time period where we had to stay at home. Thankfully, that's over. But there will still be people that need to stay at home, and you need to take it very seriously. If you were contacted because you were exposed to somebody in close quarters for a sustained period of time who was contagious, you need to honor that isolation and quarantine for yourself. So rather than quarantining an entire society, it's only done for those who were immediately exposed to COVID-19 to stem that transmission and be able to get us back to normal as soon as possible. Last question.
I know that this is more of a local and city-town issue, but just wondering your take on, we've heard from some business owners that the onus is on them to make sure that customers that are coming in are wearing masks, and if they're not, that it's not the person not wearing the mask that gets the fine, but it is the business owner themselves. I don't know if you're familiar with that, but...
So at the state level, we require the workers in retail for their own safety as well as the safety of the customers to wear a mask when they're interfacing with the public. That's very important for a couple reasons. It's important, of course, for employee morale and to keep workers in retail safe. It's also important to prevent the outbreak of COVID-19. And finally, it's important to inspire confidence, to get customers to be willing to go back into stores knowing that the people behind the counter who might encounter hundreds of people today, every day, including people with COVID-19, themselves have masks to help prevent the outbreak, even if they're asymptomatic and could spread it. This is being enforced locally in different areas in different ways, but certainly the state is very serious about making sure that those who work in retail, that are in regular contact with the public, wear masks for their safety, the safety of the customers, to prevent the public health crisis from worsening, and to increase consumer confidence. Thank you all very much.